Welcome back. March is National Colorectal Cancer Awareness Month, dedicated to increasing screening, promoting early detection, and supporting those affected.
And joining us to talk about this very important topic is Dr. Arthur Affleck IV. He's a colon and rectal surgeon with Lifebridge Health. And doctors, thank you so much for coming in. We were just talking about this off camera. It is so important. And tell folks, for those watching who may not know briefly, colon cancer, the signs, maybe just generally, kind of give us colon cancer 101.
For sure. So colon rectal cancer is the third leading cause of cancer-related death worldwide, and it's caused by genetic alterations in the tissues that later becomes the tumor. And this can be inherited as it's passed down through family, or it can be sporadic, where are random mutations that are influenced by genetic predisposition, diet, environment, etc. One of the interesting things is people always ask, what symptoms, what I got to look out for? And a lot of times you don't feel anything, which is why it's so important to get screened based on your individual risk.
Okay.
Well, that's scary, and how common it is. So when we're speaking on that, who is most at risk, and are there certain lifestyle factors that might increase that risk for someone?
For sure. So if you have a first-degree relative, as in mother, father, sister, brother, is a significant risk factor. And then other environmental risk factors include smoking, a diet rich in processed foods, red meat, and those are big ones.
Okay. And you mentioned that there may not be any symptoms, so you could be going along. So the screening then, what is the process for screening?
For sure. So if you have a first-degree relative, then the recommendation is to start getting a colonoscopy at age 40 or 10 years before that relative was diagnosed.
Oh, wow. Okay.
Wow. And are there different, I'm sure there's now so many different kinds of screening options. Walk us through what options there are and when we should be really starting to think about that.
For sure. So colonoscopy is the gold standard, and my personal recommendation would be to get a colonoscopy. Now, at-home test, and there are multiple brands, but a common one that most people know is the Cologuard test.
Right.
And so they test for blood and DNA in the stool, which could be linked to cancer. The issue with Cologuard is there's a relatively high false positive rate, and then if it's positive, you have to get a colonoscopy anyway. And so symptoms that, if people do develop symptoms, things that they can look out for is rectal bleeding, abdominal pain, change in bowel habits, unintentional weight loss, things like that. And a common thing that I see in my office all the time is people are like, I had hemorrhoids diagnosed 20 years ago. It's got to be my hemorrhoids.
Oh, okay.
And that's a common thing that colon cancer always has to be ruled out in the setting of rectal bleeding.
Okay. Now, some cancers, when you find an early diagnosis, are very treatable. Others may be a little more difficult. Where does this fall in that scale, in that, in that range? Absolutely.
Prevention is pivotal to preventing this from developing cancer in the first place. So a lot of times, if we remove precancerous polyps on the colonoscopy, these cancers or these polyps will never become cancer at all, and eliminates the need for further treatment outside of the colonoscopy. And additionally, if we do find cancers at earlier stages, oftentimes they're easier to treat and can often be cured.
Oh, okay.
So early detection really is key for this. And what advice are you going to give? Can you give patients when they're managing this throughout their health, during, before, after, all this stuff?
Yeah, I think a big thing is understanding your individual risk. So know your family history, and then don't ignore symptoms. Over the last several years, we have seen an increased incidence of patients being diagnosed with colorectal cancer at younger ages. If you're diagnosed below the age of 50, that's actually called young onset colorectal cancer. And so even if you're younger than the age of 40 and you don't have a family risk and you're of average risk and you have rectal bleeding or some of those symptoms I mentioned, talk to your PCP, get referred to a gastroenterologist or colorectal surgeon and get it checked out, because it is a very common and very preventable disease.
And that was the question. Where do we start? So your general practitioner, your general doctor, and then a referral to you.
Yep, to either a colorectal surgeon or a gastroenterologist to get the ball rolling.
All right.
Dr. Affleck, thank you so much. We appreciate it.
Great information. Absolutely. You got a lot of folks, I think, thinking. Thank you so much.
For sure.
All right.